What in the world are you talking about? Thank you very much. And Joyce, you didn't get a group sing, did you? Ray didn't get a group sing. Karen Lewis didn't get a group sing. Sarah didn't get a group sing. So I really thank you. That was pretty much okay. I tell you what, I really appreciate everybody coming. I've been absolutely terrified that I was going to get up here and see all you people, and you know, I was going to miss thanking somebody. So I have written down a few things. I hope you don't mind. This may actually take a little while, but it's okay. I don't know where to start. That Bob Gretchen knew I was going to do this. That's why I took off. No, I'm not going to do that to you. But I do want to say a few things about one or two people. It's going to be short and sweet and really to the point. Well, first, Ray Cope for hiring me, Karen for keeping me, and for the staff for putting up with me. And that probably is the greatest challenge of any of them. 14 and a half years has gone fleeting by. Just in this very room. Where's Vance anyway? Vance is here someplace. Vance. We were going away. I was just coming on. Vance was retiring and had a nice dinner for him. And I was just coming on. And it just doesn't seem like that long ago. It really, truly does not. It really has been a blast. I kind of took the liberty of looking back and seeing what has been kind of done in 14 and a half years. And I noticed that we have processed, in my time, almost 3,400 grant applications. Now, I did have some help, but that was $250 million that has gone out the door in my tenure. And that's pretty staggering when you think about it. But really, when you think about where did it go? And I look at some of the grants we have done over the years, in the early years and the more recent years, and KBR has been such a player in this state. When you're talking about access to medical, dental programs, that these programs simply would not be there. And that is a great tribute, of course, to Mrs. Reynolds and for the staff to get these things out there. But it also has to be said, I think, that it's just not the grant-making part that I think has been very, very important. And that is that we have participated also in things that I think have expanded and multiplied over the years that we have been a part of. A couple things come to mind. The Community Care Network in North Carolina, that was really started by Jim Bernstein, and now is a national model for Medicaid. Better service to Medicaid patients at less cost and all the rest. We've also started the community practitioner program many years ago to try to get physicians into rural areas and hard to place. And that's been going on since 1989 and is continuing to go. So there are many other facets of just not grant making that we have contributed over the years. So I must say it has been absolutely unbelievable privilege of mine to be part of Mrs. Reynolds' legacy, because it has been a small part. And I can't tell you how much it has indeed been a privilege. Now, Karen just asked me the other day in a car, and I started thinking about this. What are you going to miss most? Well, a paycheck for one thing. That came to mind. Mary said that too, by the way. And then, I have nowhere to go on January 2nd. That's going to be something. But that's an easy answer. It really will be the people. We have a very unique staff, a cast of characters, as you just clearly saw. That's hard to miss. And my past colleagues on the staff have just been tremendous to a person. And I really do appreciate them. I can't tell you how much I appreciate the advisory boards over the years as well, particularly the healthcare board that I have most contact with. Despite what Tom said, what Gene said, I really have very much appreciated and respect the boards, all the advisory boards, and how serious they are taking the business of the trust to heart. They do their homework, and they're very, very dedicated folks. And I can't tell you how much I really enjoyed that relationship with those people. Now, we have some state folks here too. Leah, Steve, folks like that. I've thoroughly enjoyed my relationship with the state folks. I don't know, I'm sure it's the case in other places, but North Carolina gets its money's worth out of a lot of our state employees. And those two are just two examples of tremendous people with great ideas and an easy working relationship. And I can't tell how much I appreciate them and what they do. So it kind of goes on and on. And then just when I think back of really the things that I truly enjoyed, it was already touched on a little bit, is the whole site visit thing. Because what it really comes down to, I can't tell you how much I've learned from people that are on the ground, that are doing the work that we want for North Carolina. That has been a true eye-opener to me, because frankly, when I came to the trust, I was a hospital administrator for 23 years. I knew acute care. I really didn't know health care. I didn't know about mental health. I didn't know about dental health. I didn't know really about exactly even what the health departments did, for that matter. I shouldn't even admit that, I guess. Gina, what do you think? She knows I didn't know anything about it. It's a quick study. But truly, it's been magnificent to go around the state and see what people do. Many times with such small, little resources out there, and some of these folks who are underpaid. We should be very, very thankful that there are folks out there that are doing this, because I think it's really mission work, for that matter. So I come to this point and say thank you to each and every one. I've often said, kiddingly, that I'll probably lose 95% of my friends when you're a funder and you retire. You lose probably almost all your friends. But I have been blessed beyond my expectations. I've been blessed probably more than most people I know. And part of my blessing has been the friendships and the people in this room. And I can't tell you how much I appreciate each and every one of you for coming today, and all those folks that have come to the other drop-ins. That wasn't as bad as it sounded. I mean, that wasn't as painful as I thought it was going to be. We went to the Tom Bacon room in Asheville. But again, thank you all very much for coming today. You stick around for a little while if you'd like. I do have to go shopping for a hammock to put in the backyard. So, and again, thank you all very much for coming today and for your support and friendship. I very, very much appreciate it. Thanks.